Hi, welcome back. In this series of videos, we're going to be going over the special senses, which will include the eye, ear, taste, and smell. So first off, we're going to go over the eye. When you're looking at the eye, you can see the eyelashes, the eyelids. The white structure you see here is the sclera, white of the eye. And then the colored portion you see is the iris. It has a hole in the middle of it called the pupil. It looks black because in the very back of the eye you have this pigmented layer, and so it looks dark, but actually the fluid within the eye is crystal clear. And just behind this hole is going to be the lens. The colored portion is the iris, and then you have a window-like structure that goes from here over the top of the iris, and that's called the cornea. Ophthalmology is a study of structure, function, and diseases of the eye. So when you have things that damage the eye, such as people poking their fingers into it, or conjunctivitis, or you need glasses, you go see an ophthalmologist. When we look at the accessory structures of the eye, they include the eyelids, eyelashes, eyebrows, the lacrimal apparatus, which includes the lacrimal gland and the various ducts that lead into the nose, as well as the extrinsic eye muscles. Extrinsic eye muscles are the exterior muscles that are going to move the eye from the outside. So the eyelashes and eyebrows, they help to protect your eyes from foreign objects, perspiration, direct sun rays, and light. So for example, if you look at Sesame Street here, that unibrow that goes across is a great way to protect your eyes. In fact, I wouldn't mind having a unibrow because it will protect your eyes that much better. You also have eyelashes that protect it. In fact, some people are so concerned about their eyes, they use false eyelashes to help protect their eyes from things that would fall into it. The functions of the eyelids, they protect the eyes from excessive light and foreign objects. They shade the eyes during sleep. And whenever they blink your eyelids, they help to spread lubricating secretions over the eyeball. And shown here are the eyelids. You have the upper palpebrae and the lower palpebrae. There are various glands within the eyelids called tarsal glands. A stye results from an infection of a sebaceous gland at the base of an eyelashes. You're also going to see, or we'll talk about in the study guides, meibomian glands secrete a lipid-rich material that helps to keep the eyelashes, not the eyelashes, but the eyelids from sticking. And these styes can be very painful on the eye. That's just an infection of a sebaceous gland. The conjunctiva is a protective mucous membrane that covers the sclera, but not the cornea. So when you look at the conjunctiva, the white of the eye, the sclera, the conjunctiva covers the anterior portion. It doesn't go completely around the sclera, or completely around the whole eyeball, just on the anterior side of it. And then you also have a conjunctiva, besides being on the sclera, but it comes up underneath and attaches to the eyelids. Therefore, you have this membrane-like structure that stops things from getting behind the eye. The conjunctiva has lots of blood vessels that run underneath it, and if they get inflamed, then you have what's known as the bloodshot eyes. Due to dilation of those blood vessels in the bulbar conjunctiva is over the bulb of the eye. You have the palpebrae conjunctiva that goes in underneath the eyelid. Conjunctivitis, also called pink eye, is inflammation of the conjunctiva membrane. It's due to pathogenic infection, although it doesn't always have to be a pathogen. Allergies or physical chemical irritation can cause the bloodshot eyes of the conjunctiva. However, most of the time when you see especially school-age children having the red eyes, itchy eyes, a good portion of that time it is due to a pathogen, either viral or bacterial. The lacrimal apparatus consists of this lacrimal gland that secretes lacrimal fluid or tears over the eye, and then those eyelids are going to move up and down to spread those tears over the eye to moisturize the eye. The tears contain an antibacterial enzyme called lysozyme. It also has water and various salts within it. Now, if you look at your eyes closely in a mirror, you're going to see that there are two small openings on the eyelid here, one on the top, one on the bottom towards the corner. And these are called lacrimal punctum, as the actual hole, and they lead into a lacrimal canal, which lead into a lacrimal canal or lacrimal duct. And then these are going to go into what's called a nasal lacrimal duct or canal, and that drains right into the nose. So the moisture that you have in your eyes instead of just evaporating off, a lot of that moisture goes through these ducts into your nose. Have you ever noticed when you start to cry, the tears can go over the eyelid? However, right after you start to cry, what happens to your nose? Your nose starts to run. That's because the excess tears are draining in through these lacrimal ducts, into the nasal lacrimal duct, right into your nasal cavity. That mucous membrane in the nasal cavity needs to stay moist, and that's why you have this apparatus here, is to keep moisture in the nasal cavity, or contributes to the moisture of the nasal cavity. And when you cry and you have those excess tears, that causes your nose to run because it's going through these ducts. Or if you really want to see something gross, people can send milk or something up into their nose, and then they push hard, and the milk can actually come out these little openings in their eye. I would not suggest doing that, as it takes a lot of bacteria and all that's in the nasal cavity and sends it up through these ducts. You have 6 extrinsic eye muscles that control the position of each eye. These consist of 4 rectus muscles. We have the superior, inferior, lateral, and medial rectus. And then you have the 2 oblique muscles. You have a superior oblique and an inferior oblique. Each eye has these same 6 extraocular muscles that move the eye in various directions. So the 6 extrinsic eye muscles, the 4 rectus and 2 oblique, and they help you to see things with binocular vision. So you can get beautiful vision looking at things such as North Shore Lake Tahoe here. And you can be riding your bicycle or walking your bicycle along the Flume Trail. Beautiful, beautiful view. But you want to make sure you have good binocular vision. And so your eyes tracking together and slightly apart from each other, that's 2 eyes slightly apart, are going to give you what's known as binocular vision. It gives you depth perception so that you can do things such as go along the trail here, the Flume Trail, and have depth of vision, keep you from going off the side. The eyes need to move together, and you have extraocular muscles that are going to move those eyes, keeping them just slightly apart to give you that binocular vision. If they're out of alignment just a little bit, that can cause double vision. So for example, if you have a disruption of binocular vision, this results in diplopia, also known as double vision. And you can do this to yourself by just taking your finger, make sure it's clean, and you don't want to put it right on the sclera, but you can put it right over on top of your eyelid and push one of your eyes just slightly out of alignment, and you'll begin to see objects such as this right here. Because you're taking the eyes out of alignment, it causes diplopia, or double vision. A condition known as strabismus is where you have a misalignment of the visual axis and loss of binocular vision. It affects about 5% of the population. There's various types of strabismus. You can have esotropia, where one or both eyes point towards the nose. Exotropia, where one or both eyes point away from the nose. And hyper or hypotropia, where the eye points up or down. Now, this misalignment is going to result in double vision. The reason for strabismus could be due to either an underacting or overacting eye muscle, or you can have abnormal innervation of those muscles, some physical trauma, or a central processing problem. It can result in permanent loss of vision in the weaker eye if not corrected during early childhood. There's a critical period in which those eyes, the images coming back to your occipital lobe, when you have a newborn and their eyes are kind of going different directions and all, but within the first few months they start to track together. That helps to keep the connection in the occipital lobe on what's called these ocular dominance columns in the occipital lobe. It keeps those connections strong so that you can align the eyes and have good vision. So you have a unison of the 2 eyes coming together to give you that image. If you have one eye that's off of that axis, then the brain can shut off the image of what's coming in from the eye that's off, because it doesn't want to see 2 images that can't be merged together. It wants to have both images come in that are merged together as a single image. If it can't align them, early on that brain will shut off the input from the eye that's going off to the side, and you essentially become blind in that eye, and we call that amblyopia. And what they can do is, generally the initial therapy for this includes intermittent patching of the good eye before they go in and do more invasive procedures such as surgery. So they patch the good eye, and that forces the bad eye to align correctly, because that's the one you're going to use for your main vision. Glasses can help correct this. If glasses or the patching doesn't work, then they can go in and do surgery where they will adjust the muscles, the extraocular muscles, adjust the tension on those muscles in order for the eyes to align. So next up, we're going to go over the structures of the eyeball.